Radiation safety is something that I think as a fellow coming up the ranks through general cardiology and even in your first year of interventional, you don't come to appreciate. But when you realize the consequences of being around radiation all day, wearing 40 pounds of lead, that can have a big impact on your career.
We do not necessarily tune in too much because our focus is learning the art and not particularly learning the ergonomics of radiation safety.
I think radiation safety is a really important issue that is sometimes overlooked in a lot of cath labs, both for the patient, the staff, and the physicians.
I think this is a very important topic that probably is not getting all the importance that it truly deserves.
There is need, well, there's enthusiasm for the fellows to learn new procedures at the same time to learn how to protect themselves, because it's a cumulative radiation over the course of a career.
You know, as we do more complex procedures, my own personal exposure is something that is of, significant importance because I'm in the cath lab all day. Being there, you're the closest one typically to the patient, so you're getting most of the scatter radiation.
Well, I already have 3 kids, so in terms of my own concerns about radiation exposure, I'm pretty much done procreating, so I'm not worried about it from that perspective. But, obviously looking towards a long career in interventional cardiology, 30 or 40 years down the line, we do know there's a signal for increased risk of some lymphomas, some non-solid tumors. So absolutely, it's a major concern of mine.
There's always the concern that comes with radiation exposure by itself, with all the problems that come with injuries, cancers, and other problems such as glaucoma, and you name it.
I would not say it's stressed enough because it varies from institution to institution, and it also depends on if, let's say, one of the attendings in my cath lab is a specialist and he loves radiation safety, then that institution is going to have much more rigorous education in radiation safety as compared to any other institute.
At Scripps, we've really made an effort this year to try to curb our use of radiation, particularly by using low-dose fluoroscopy, really minimizing the time we're on fluoro and cine fluoroscopy, as well as using other specialized techniques like Ankur balloons and trap balloons to try to prevent us from being on fluoro when we don't need to.
It's about time that we probably start looking radically outside of the box. Fundamentally, we've been doing cath pretty much the same way Mason-Sones started doing it in the 1950s. And at the risk of sounding very millennial, I think 1950 is calling, it wants its cath back.
I think our generation is probably, maybe more cognizant because we're getting so much education on it. And also you see some of these smaller registries of increased risk of cancer in some physicians who are around radiation.
The interventionists that I work with, and they're certainly not my generation, are extremely cognizant of the fact that they have to be ergonomic and judicious with radiation use.
I think that we definitely look at it in a different way, but I wouldn't say it's just because of a generation change. I think there's also a component that we've also come a long way when it comes to understanding the problem and all the advances and all the awareness that happened about it.
I think some positive changes would be to look into more options for blocking or mitigating radiation, such as the rad pad or wearing any kind of other lead protection.
I think whenever we go to all the conferences like CRT or TCT, there should be a mandatory or required. I mean, it's tough to have something mandated, which is very, very difficult to implement. But try to have at least a requirement, like a CME requirement for fellows who are in training every year to have a radiation safety course.
I think that most programs around the country could do a better job, maybe having like a 2-week boot camp where radiation safety is really included as a major part of that. So absolutely, I think we can do a better job.
I think there is room for, and I personally believe that there is acute need for technology to get better to reduce us to the radiation exposure.
It's our job as operators, as doctors, to also come up with our own suggestions about how to take care of ourselves first so we can take care of our patients next.
As with anything else in medicine, I think the more you're exposed to it, the more you start thinking about it.
I think it needs to be brought up even more. There's room to mention more and more. Like anything the more reminders there are, the more people will take it safely. They will take it more seriously.
I think we're doing a very good job so far with what we have in order to make radiation exposure a very clear issue and avoiding it a very important goal. The question is, where do we go from there and how can we do it even better?